The reason that we do a family program, many people think that we do it for the addict or alcoholic, and that's a misconception, and that's why we wanted to get information out to everybody that it's really a week for them. So what we see by the time family members make it to us is that they're exhausted on every level, emotionally, financially, spiritually, socially. Parents or spouses are doing all this work and putting all this energy into taking care of their addict or alcoholic, and what they don't realize is that by doing that, they enable them to continue drinking and drugging.
Typically, when people come into the family program, they're dealing with a lot of fears in regards to the relationship. It's like a tornado has ripped through their relationship and they're not sure quite what to do with it. In their involvement, in their participation in this incredible 5-day experience, they're going to have a chance to increase the probability of success for the addict.
What happens is, because of the obsession to try to fix and stop and start the other person's addiction, the loss of identity of self, the loss of care of self goes right out the window. During the week, people should expect to first start to talk about their experiences living with addiction, how that takes the focus off themselves and how they try to control the addiction of the addict. And then by the time we've done the week, hopefully, people have gotten to see how they need to take care of themselves, what they can and they cannot do with the person with the identified addiction, and how taking care of themselves will foster both good things for themselves and also for the person who's in the treatment program.
We really try to teach the family that this is a disease that the loved one has to work on. And as much as they love them, they can't fix it. And sometimes that's a release to them. Sometimes it takes a while for the family to really get adjusted to the fact that they're not in control, that they can't fix it. When I see the same people on Friday that I've met on Monday, and just the aha moment of, I get it. I can't help them. I can love them and I can care for them, but I can't take care of them anymore. That for a mother to be able to say, I love my son. When on Monday, she was so exhausted she couldn't even say that because she was so involved with the addiction, that she gets it on Friday that she can love them and let them free, set them free.
One of the many things that I've learned this week that's been beneficial for myself as a sister living with a person that is an alcoholic is actually understanding the disease and putting what I thought was theories into facts about the fact that alcoholism and even addiction is actually a chemistry that's inside someone's brain. So I felt that that was very beneficial for myself as I dealt with my sister being an abuser of substance.
Family Week for myself and the other families that have come has opened our eyes to the fact that we have a lot of changing to do ourselves, that the fear of our addicted loved one coming home is based on not knowing what to do when they get there. And in the last week, every minute has been precious.
And I would actually encourage every family member, even those that are not living in the same household with this family member, or even living at a distance, to come and be a part of this family week and really get to understand and learn how to cope with their loved one as they're coming off a substance.
So the family members, whether that's a wife, a husband, parents, relatives, brother, sister, can begin to take care of themselves more, can begin to understand how to take care of themselves, and then in doing that, that will help them detach from trying to fix and manipulate and stop or start what's going on with the addict. For the addict, that then gives the addict the experience of being allowed to take care of themselves, of focus on their own addiction, and not be trying to manipulate or respond to other things that are going on within the family system.
They leave laughing and relaxed and self-assured that they know what to do next. You know, we all need a roadmap, so to speak, and when you're dealing with an alcoholic or addict, you don't have any roadmap. And so once you get to the end of this week, you have a roadmap for how to live. We want to, number one, help the family members learn to cope in a healthier way so that they don't lose their lives. And secondly, so that they can enable the alcoholic to do better and to get better sooner.
I also felt, or rather I learned, how I'm supposed to deal with her once she leaves this program. I think that that's where a lot of family members get lost. They don't come down and they don't learn about the program where their loved one is. They don't see the environment. They don't get in contact with their therapist or whether their loved one's therapist. Get to know the facility and understand that these individuals here really do love and care about your individual, and they want to see them get better. And they want them to be able to leave and come out in society and be productive like they used to be.
I would not miss it. I wouldn't change it. I'd just accept the program as each day passes. This is the best thing I've ever done for myself, and I'm sure recovery is the best thing that he's ever done for himself.
So what they can anticipate leaving with is a better understanding of what exactly has occurred in their life. And that's walking through some of the denial. I am going to have an opportunity to introduce you to a person that you may have forgotten, and that's you.